I'm going to go through a little bit of anatomy, a little bit of common questions that come up, I would say, whenever it comes to gut health. By all means, feel free to ask questions. I like it when people interact, so raise your hand. We are a little short on time sometimes, so I'll try to keep it short with questions, but by all means, feel free to ask them. Okay, so to start with, let's see, I might have to a little bit smaller. So I don't know about you, but it definitely seems like everyone I know and their mom and their uncle and their cousin all have digestive issues. It's such a common thing. And I was actually trying to find stats. Okay, well, how many people actually really have gut issues? And a survey that had over 71,000 people in it found that 61% of people have more than one major, I shouldn't say major, but moderate to mild digestive complaint a week. And of those, many of them have them chronically for 6 months. So that means acid reflux, that means bloating, that means heartburn, diarrhea, constipation, something along those lines. And that's just kind of considered normal. And so most of those people do not seek out any care for that because people just kind of manage it with Tums or Miralax or whatever it might be, or they just kind of deal with it. But of people who have true digestive complaints, 10 to 12% of Americans have irritable bowel syndrome. So that means you're either chronically constipated or chronically have diarrhea or both. It kind of goes back and forth. And then 1% of people have irritable bowel disease. And the difference between that and irritable bowel syndrome is really just the level of inflammation. Today we're not going to really be getting into either irritable bowel syndrome or irritable bowel disease because there's just not enough time. But we can always come back and talk about that some other time if that's what you guys want to learn more about. So the gut doesn't just impact the gut. It's not just diarrhea. It's not just bloating. It actually goes out and impacts most other systemic parts of the body. And I will go into this in a lot more detail in later slides, but just so you know that we will be getting into that, and that it does impact brain health. It does impact your joints. And this is why even if you feel like, okay, I have pretty regular bowel movements, if you have a lot of joint pain, if your immune system is compromised, it's still worthwhile to look at your gut to see really what's going on. Okay, so first we're going to start with digestion starts in the mouth. Well, that's a no-brainer. But what most people don't really realize is that our taste receptors on our tongue are kind of like this giant switchboard. And it communicates with our brain and tells our brain, okay, what digestive enzymes do I need? How much bile acid are we going to need to produce? So even before the food gets into your belly, we are informing our brain about what we are eating. So this is majorly important with, if you eat something that is sweet, your insulin starts producing even before it hits your stomach. And so people who do a lot of alternative sweeteners, yes, it does decrease the amount of glucose that goes into the bloodstream, but it can still spike your insulin. Something people don't know, which I think is really interesting. The most interesting thing that I know about that is that we have 25 different receptors for the bitter taste. So nobody likes bitter, especially not in our culture today. We have very bland food in general. And it's kind of a shame because the bitter receptor is actually what regulates our digestive system to move. And so when people are constipated, people have bloating, what they might be missing in their diet is just a balance of bitter foods. So an old school remedy is you would use bitters. So there are different herbs that are very bitter in taste, and if you had indigestion, you would just, take a little squirt of a bitter, and that would help. And now we know why, because we are programmed to eat a lot of plants, and because in general, even if you go to the grocery store, there might be, a range of like 12 to 20 plants, and in general, they're kind of watered down from what they once were whenever they were found in the wild, so they don't contain as many bitter compounds. And so that's something is one of the factors as to why a lot of people have digestive health complaints. It's because they might be missing that bitter element in their diet. So this is just a picture of the brain. So these are the receptors, and they go up to the brain, and then the brain sends information down to the digestive tract and informs the digestive tract on how to prepare for what you're eating, which I think is just so beautiful. Okay, so the second part, the stomach. So the pH of the stomach is between 1 and 3. It's necessary to be that low to break down protein, to break down fat, and it's actually one of the most important parts of our immune system because it prevents bacterial and viral and parasite overgrowth. What's really interesting is that a lot of America right now actually takes medications that block acid production, so PPIs. PPIs are common medication prescribed. And it goes on this, I believe is probably not the right word. It's with this understanding that some people produce too much stomach acid, but a lot of research is actually coming out that a lot of people stomach acid. So this is a major point of confliction between basically conventional medicine and functional medicine. Do you have too much stomach acid, or do you actually have too little? And the way to properly test that is to go to a doctor and have it assessed. But there's 2 tests that you can do at home, which are actually very informative. So the first one is it's the apple cider vinegar test. So you just take a teaspoon of apple cider vinegar, you put in a little bit of water, and you wait, and you see, okay, is that going to increase my heartburn? Is that going to increase my stomach acid? And for people who truly do have too much stomach acid, they will not be happy the rest of the night. So that does happen. But actually, the vast majority of people, and either, there's one of 2 things that happen. They feel nothing, or they feel better. And so if you feel better whenever you take a little bit more stomach acid, then that likely means that you actually don't have enough stomach acid. And so people's, you can buy hydrochloric acid supplements out there, but the cheap and easy way to do it is vinegar, lemon water, things that people probably have around their house. Those little things can be very impactful in just helping overall digestion. Another test is a baking soda test. So I actually had not heard this test, and recently people have been coming in and saying, oh, I failed the baking soda test. And I said, what's the baking soda test? Well, this is what it is. You take 1/4 of a teaspoon, and you mix it with a little bit of water, and you drink it down. And so baking soda, and if you ever did that experiment, whenever you made like a volcano where you mix acid with the baking soda, that is a chemical reaction. Gas, I can't tell you actually what kind of gas, but gas is produced as a result of it. And so the test is you take down the baking soda, and if in 3 minutes you burp, that means that you have sufficient. If you don't burp within 5 minutes, then the theory is, okay, you might actually be low in stomach acid. So this is definitely not, a gold standard. If you really want to figure this out, you really do need to go to a doctor and get this assessed. But I think it's a pretty interesting thing that you can do at home, and I think it definitely can give you a clue as to, okay, do I actually have high stomach acid or do I have low stomach acid? And so then the next question says, well, I have heartburn, so of course I have high stomach acid. But actually, what they are actually finding is that people with low stomach acid, what happens is so the little sphincter that's like right here, it's like this little band that holds everything down. That tightens in response to stomach acid. So if your stomach acid is low, it actually kind of loosens up a little bit. And so that's part of what might cause the stomach acid. And then another factor, people have a lot of gas and bloating. Well, if you have a lot of gas and bloating, and it's almost like a balloon, which is down here, is going to blow up. It kind of pushes the stomach upwards just a little. An extreme version of this is called a hiatal hernia, but people have like a functional version of this very often, where they kind of get this upward motion, and that upward motion can also cause a little bit of that stomach acid. So a lot of people get the bloating to go down, people's heartburn will go down too as a result. So, so this is just, something that is still not clearly understood is the nice way I'm gonna say that. But I do think that we need to be a lot more diligent before just putting people on PPIs, because stomach acid is extremely important in not only digesting your food, but also, absorbing nutrients and doing other things like that. So I would just say, if you or someone you know gets prescribed a PPI, just maybe consider it and maybe question it a little bit, because there's a lot of other things you can do that potentially can help the heartburn that don't necessarily have as many side effects as the PPIs. Okay. So this might not be something you think about whenever you think about the digestive tract, but the vagus nerve is the main nerve that comes from the brain, and it is what innervates the entire digestive tract. And we need the vagus nerve to be functioning properly for proper digestion. But the vagus nerve does many different things. It really helps regulate that rest and digest. So if you're in that stressed out state where you feel like you're running from a tiger, your vagus nerve kind of gets shut off. And whenever it's shut off, your bowels aren't going to really move very well. Most commonly, people get constipated. People with anxiety often have constipation that goes along with it. But some people will get diarrhea too. And the best example that I have for the vagus nerve is whenever you get upset and you get that little knot in your stomach, that is your vagus nerve kind of talking to you, saying, okay, we're going to shut down digestion because there's other things we need to deal with right now. But if you kind of always live with a little bit of a knot in your stomach because you're kind of always on high alert and your anxiety is always going, well, then it doesn't matter what supplements you take, what diet you have, there's a good chance your digestion is going to be compromised. And so working with the gut isn't necessarily. Working with the gut is often really working on mind-body awareness, working with stress and learning how to manage it. And another thing that can actually really influence this is not just stress, but neural inflammation in general. So people who have concussions, for example, it's really common that people have a concussion and then their digestive tract just goes down. It's almost like things kind of stop moving the way they need to. So that is because whenever there's inflammation in the brain, the vagus nerve also kind of shuts down a little bit. And so that might be something to think about. A way that you can test whether or not your vagus nerve is working from a neurological level is actually test your gag reflex. Don't do it now. Go home whenever you're brushing your teeth. Just kind of push your toothbrush back there and see if you gag. If you can push it back the whole way and touch the back of your throat without gagging, that's usually an indication that your vagus nerve is actually a little bit shut down. We're not supposed to have too much of a gag reflex, but we're supposed to have a little one for a purpose. And that, the mouth is just the very beginning of the digestive tract, and usually if that's a little bit shut down, then that will follow throughout the rest of the digestive tract. And actually, what we'll do to kind of rehab the vagus nerve, if that's the case, is we'll have people gargle. So you gargle for at least a minute, which gargling for a minute doesn't sound that hard, but try it. It's a bit of a pain. So you almost have to figure out how like a chair that you can lean back in, and so that you don't have to just like crank your neck for a minute. But that is something that we will offer. And it does help. It definitely changes things. I had a patient who had complete gastroparesis to the point where they had to actually put a feeding tube in because he just, he wasn't able to move things along his GI tract. And I started having him gargle, and I started having him also kind of suck his thumb, which was a very weird thing for him, and he really did not like that, but it worked. And he started having bowel movements, and he started being able to take things by mouth. And it was fairly simple, considering all the things that he had been through and tried to figure out. Okay, so this is a beautiful picture of your small intestine. Like, look at that rabbit hole. So all these little projections here, these are called cilia. And they project out, and they create, the reason why they project out the way they do is because they create a massive amount of surface area. So there's over 2,500 square feet of surface. It's pretty wild to think about. And all of these little projections, they move like in a wave-like fashion. It's really beautiful if you actually just see a video of it happening. And so that wave-like motion is called the migrating motor complex. You don't need to remember that. There's not going to be a test. It's an important complex that allows you to push the food down your digestive tract. When this gets compromised, so does digestion. So this can get compromised from a couple different ways. If the vagus nerve is compromised, what happens is this migrating motor complex will kind of shut down, and it will stop moving things along. Another way that it gets shut down is if you get food poisoning. So food poisoning can actually shut it down semi-permanently. It's kind of hard to figure out why, but that seems to be the case. And other types of infections can also shut it down. So what happens is, if this gets shut down, the food doesn't really move down the way it needs to. Bacteria kind of get backed up. This part of your digestive system doesn't have too many bacteria in it. Most of the bacteria in your gut happen farther along the line. But if this doesn't move, then the bacteria kind of stick around and start creeping upwards when they're supposed to move downwards. And then what happens is, anytime you have a place that's warm and has food, you will start digesting those foods. The bacteria will. So they'll actually start fermenting the foods. So when people have a lot of bloating, it's usually because this migrating motor complex is a little bit slow or completely shut down. So the term for this is called small intestinal bowel overgrowth, SIBO for short. Some of you guys may have heard of it before, but this is ultimately what's happening. Bacteria are in places that they shouldn't be, and then they ferment your food. A way that you can see if this might be something that you're dealing with is if the bloating comes on after you eat fiber. So bacteria love fiber. So if an apple makes you bloat, that's a problem. That means that there's bacteria where there shouldn't be. If oatmeal makes you bloat, that's a problem. And so that's usually a telltale, okay, maybe I should go see somebody and figure out this. Because usually the treatment for it is some kind of antibiotic, or we use herbs, herbs that have antimicrobial activity. So that means they kill things like the same way an antibiotic does, but they work slightly differently. Okay. So this is a very meager slide on a very big topic. And that's because I actually didn't want to put too much effort into the leaky gut. A lot of you probably have heard of leaky gut. That's probably why you're here. I do believe in leaky gut. It's not that I don't, but I don't like to put all my focus there. I like to put it down a little bit farther and explain where. But basically, the whole hypothesis with leaky gut is that you saw the picture earlier with here. So basically, in between each of these cilia, and even more so on an even smaller scale, because there's many, many cells within each one of these little projections, whenever inflammation happens, it causes the cells, which are supposed to be tight together like this, to kind of loosen up a little bit. And in extreme cases, really loosen up a lot. And then what happens is whenever there's kind of these spaces in between these cells, big particles that shouldn't be able to get into the bloodstream get into the bloodstream. And so that could be bacteria, that could be food, that could be viruses. And it's because that first layer of protection is no longer there protecting it. And so when people talk about food allergies, for example, most of the time, well, there's different types of food allergies, I should say. There's some food allergies that are like peanut allergies that will send you to the hospital. Those are a different kind. But there's food sensitivities that you can eat it and they might make your joints flare up a little bit. You might notice that you get a headache every time you eat it. But it doesn't send you to the hospital, but you can just tell you don't really feel good when you eat those foods. So that is we often related to a leaky gut. I think that people are, not the food sensitivities aren't real, they're very, very real. But I think it's very easy to get into the trap of, okay, this food didn't make me feel good, I'm not going to eat it anymore, and they remove it from their diet. And very quickly they get into this like food prison where they don't even know what to eat, and that place can be very stressful. I try my best to not encourage that of just, okay, every time I react to a food, taking it out of your diet. And the reason why is because not every food reaction is a food sensitivity. As I just said, like if you have SIBO, you might react to an apple. You might get really bloated from an apple. And that's not because you have a sensitivity to it, it's because you have bacteria in the wrong places. And so what they've definitely found is that even though you might have some key foods that are super inflammatory, like gluten, like dairy, certain nightshades can be, taken out, but a lot of the other foods, they actually help supply the bacteria with the fiber that you need to build a healthy gut. And so it's better sometimes, I think, in my opinion, some practitioners will say differently than this, to maybe remove the key guys, but then keep almost everything in and we'll talk about. So I put this little example up of a food allergy test because this was a woman who came in and thought that she might have a lot of food allergies. And really there was only a few that she was really reacting to. And that was just a good example of like, okay, this is not truly what it is. There's a lot of other stuff that we can work on besides just cutting everything out of your diet. Okay, so colon. So this is where water and minerals are absorbed. It's about 5 feet long, and this is basically where your microbiome lives. So your microbiome is I'll put it on here. It's this giant organ that lives inside your colon. 100 trillion bacteria live in it, and they play a massive role in your overall health. So, now really starting to understand the importance of the microbiome, and that's partly because we do a lot of things to destroy it. So antibiotics, a lot of the pesticides that are, I'm trying to find this, that we put on our foods also really compromise our gut microbiome. So that's why, even though eating organic is more difficult at times because it's expensive and the food goes bad a lot faster, what you're actually doing is you're protecting your gut from those pesticides, which really can, just as they are supposed to kill the bugs in the soil and on the plants, they also kill the bugs in your gut. And so eating organics is really important as much as you can. And not to mention, whenever you eat organic, then the vegetables themselves have probiotics on them that they have gotten from the soil. So one of the main way that we really feed our gut, because the bacteria in your gut are just as alive as you or I. They need to be fed, they need to be nurtured, and they eat fiber, is what they eat. So soil is one way that you can get it. Foods, so fermented foods like sauerkraut, kombucha, that kind of thing. Fiber, like I said. Mainly soluble fiber, actually, is probably the most impactful. Probiotics can help. What I will say is that most probiotics that you find on the market are actually too low in dosing. Because whenever you see something on the bottle that says, oh, there's 6 billion, that sounds like a lot. But 6 billion actually isn't all that much whenever you have 100 trillion. For example, like at our practice, the first probiotic that we really start people on is 20 billion. And that's kind of the lower dose probiotic. And if people have had antibiotics or something, we put them on like 100 billion. And so 100 billion versus 6 billion is hugely different, which is why a lot of people say don't do that much. One thing I will say about probiotics is if you have SIBO, like I just talked about earlier, if you're already getting bloated and then you take a probiotic, what can happen is the probiotic, their bacteria doesn't get transported down into the colon the way it needs to, and it gets stuck in your small intestine, and it can actually cause more bloating and more challenges, and actually brain fog. And so they've done a decent amount of studies that people who take probiotics get brain fog. Well, why would that be? And the reason why is if they have SIBO already, then they're not able to basically move the probiotics to where they need to be. So that's why, and we'll get into a bit later on, but why going to a practitioner who kind of understands this stuff can be very helpful at just like navigating all the nuances of how the order of what you should be doing. Because for those people, they need to do a couple rounds of antimicrobials. They need to make sure their bowels are moving. They need to make sure their upper bowel is moving too, because you can have one part of your digestive tract that's moving too fast and another not moving fast enough. So that synchronization of the digestive tract is really important too. So that's probiotics. And then prebiotics are supplements where they have specific fibers that feed specific strains. And so often what you do is you pair the prebiotics, you give the food along with the probiotics, so once they get in there, they have the proper food and they can actually proliferate to be much more. So this is a really helpful strategy, especially whenever you have kids that are really picky eaters, whenever they only eat dairy and gluten and they don't eat any vegetables. Sometimes the way around that is to give them a prebiotic so that the proper bacteria in their gut get fed, because otherwise they're not getting fed. So an example of this is arabinogalactans. I'm not going to test you on that word either. Arabinogalactans, fun one. But that one's very helpful at producing lactobacilli. Talking about dysbiosis. Okay, So, how do you actually tell if you have dysbiosis? You can make guesses, you can tell from your symptoms, and sometimes we do that. And then sometimes, especially if someone has a lot of gut issues, we really, really like to test because it just makes your life so much easier to have a pretty clear idea of what's going on. So this, panel that we have here, very small segment. This test that we do is actually 40 pages long, and it really tells you, it gives you a very good idea of what's going on in your gut. And it's, for people who have true IBS or IBD, this can be life-changing to get an idea of that, because sometimes what you're doing is exactly what you shouldn't be, unfortunately. And also, like more so what I've found with doing these tests is that we're often just not treating enough. We're not giving people enough probiotics, we're not giving them enough of whatever they need. Or, another thing too, is if they have too many bad guys, we need to figure out what bad guys they are appropriately. When I say bad guys, I guess I should back up and say your gut has bacteria. Some of them are good, some of them are, I'll say bad. I'm never going to say anyone's completely bad, but they might be not helping you, let's just say that. This is an example of part of that test, and these little indexes that we have at the top, they're very informative. They tell us, okay, how diverse is your gut? Are there any bacteria that are just taking up too much space that they need to be cut down? And then this little pie chart tells us about the phyla. And so there's different groups of bacteria, and they all do different things. And yes, that's just a very informative part of it. Okay, so that is basically the end of the anatomy section of this, because I just felt like I had to lay down a framework before getting into some of the other stuff. So now we're going to talk a little bit about what all is impacted by your gut health. And truthfully, we could sit here for a full weekend and we wouldn't even touch the surface of this. So I'm just going to talk about some things that I found interesting and that I thought you guys might find interesting. So how does a bad microbiome actually cause inflammation? So there's this term called endotoxemia that's starting to pop up in the literature. And so it basically means that you toxify yourself, because endo means in. And so inside yourself, you make your own toxins. So the most common one is something I'm going to, just for the sake of this talk, call it a gut toxin, but the name for it is something called lipopolysaccharides, but because that's, gut toxin is just a little bit easier to say. So these gut toxins actually cross through the gut into the blood, and once they're in the blood, they go and they are attached to a cell, and then they get brought into the cell and then go to the DNA, and they tell the DNA, okay, we need to start producing some inflammation. So because of COVID, I think more people are aware of the word cytokine. Probably last year people would have no idea what a cytokine was. Now we know cytokine storms are kind of what, the problem with COVID and what causes it to be deadly. So what these LPSs do is they actually cause an increase in cytokines. Okay. So they found that LPSs, they trigger obesity and insulin resistance. So they did this really, not too inhumane to do this to humans, but they just injected mice with LPSs, and that was it. And they found that within 4 weeks, the mice became obese, and they developed insulin resistance. So they found, and that was the only thing they changed in their environment. And so it was enough to show, okay, well, these toxins that we can get from our gut really can influence our metabolic system. And in the practice, we see this all the time. To specifically women, because it's harder to lose weight as a woman, they might be eating perfectly. They might exercise every single day. We might have already tried hormones and done those kind of things, and their weight is still not really budging. And really what it comes down to is their gut, and really addressing this LPS piece. Usually with that we see inflammation up too. Inflammation, but we're not really sure why there's inflammation. It's usually because of the gut. So these LPSs can also cause that leaky gut phenomenon that I talked about earlier. So when we talk about food allergies, those are usually not what start things. They are brought on by the LPSs causing dysfunction within the gut. They've also shown that they can't quite say that it triggers autoimmunity, but what we can say is that if you already have autoimmunity, it can definitely make your autoimmune worse. And there's so many different types of autoimmune conditions, whether it be thyroid, Hashimoto's, Graves', or Crohn's is considered a autoimmune condition, lupus, rheumatoid arthritis, you name it. What they've definitely found is that they will, if it's already there, the LPSs will trigger it and make it much more pronounced. So this is part of that test that I showed you earlier, part of the 40 pages. Really insightful little diagram that we have, because it will show us, okay, you might have some dysbiosis, but it's not really impacting your gut, which is why you might not have symptoms in your gut. But it is impacting, let's say, your metabolic health. This patient, I guess that was not the case. But if that's in the red, then often what we'll see is people with diabetes or insulin resistance and obesity. Some people, it impacts their hormones more so. And so I'll get to it in the next slide, but PCOS, endometriosis, that can all be impacted by it. Liver health, so non-alcoholic fatty liver. Sometimes we'll see that in people who, and that can be impacted by your gut microbiome. So these are just examples, and this is a way that we can kind of test it and see, okay, is this something that we're dealing with? Okay, so along the same line, chronic constipation. This is often whenever we see kids that just are constantly constipated and no one can really figure out why, and then you give them probiotics and it helps. Well, this is how it helps, because it addresses the LPSs their gut is producing. So those LPSs, those gut toxins, can actually get inside the nervous system of the digestive tract and slow it down and disrupt motility. Another thing it does is it impacts it. So the HPA axis stands for hypothalamic pituitary axis. So this is like this big cascade of hormones that you have. It can go in and disrupt at different organs your hormone cascade, and as a result, an increase in cortisol, which is one of your steroid hormones. It responds to inflammation, and it can cause that. Same thing with so polycystic ovarian syndrome, which is a very, very common condition in women. I think 1 in 4 women. It was the last statistic that I actually just recently saw, which I was actually shocked by because it's increased. So 1 in 4 women has PCOS, and they've shown that these gut toxins can really influence that. Also with endometriosis, I should say, endometriosis is kind of a serious condition, and they're still trying to figure out why it happens and how it happens and how it will influence it. But they have shown that if you give somebody a round of antibiotics, for example, it can make their endometriosis symptoms lessen, become less severe. And so that is an indication that, okay, the gut microbiome really can influence that. Okay, so gut-brain axis. So this is also something that we could talk about. Some people will actually say the gut is the second brain. And that's because it produces a lot of hormones, not just serotonin, and that's the one that's gotten the most press. Serotonin, which serotonin is your happy chemical in your brain. So it's what tells you everything's okay, it's all right. Like you know, everything is sunshine and daisies. That's serotonin, and the gut produces 95% of it. It's also what we use it in the gut too. It doesn't just get transported up. We use it for a couple of different things within the body, but that gut motility, that gut movement, is controlled by serotonin as well. Influenced, I should say, by serotonin. So what we'll see is if people have constipation and their gut isn't moving, often they're not making enough serotonin. And so if you give them a little 5-HTP, which 5-HTP is the precursor to serotonin, and their brain will get better and they'll get happier. It's kind of a win-win. Brain-derived neurotrophic factor, so that is a hormone that's necessary to keep your brain protected. So protected from inflammation, protected from degradation, protected from memory loss, you name it. And what it actually does is it allows neurons to grow, and it allows neurons to heal. If you lose the ability to heal and grow, then everything will start sliding in the wrong direction, basically. And so this is a hormone that is largely produced in the gut as well. So this is a fun study that was done. So they took 18 kids with autism, and they did a fecal transplant, which there's a lot of different ways to do a fecal transplant, but it really is whenever you get a bowel movement from someone who is healthy and you give it to somebody who is not healthy. And there's a couple of different ways you can get it in them. So with this study, they actually put it in a smoothie, which I can't believe they actually did that. So like a poop smoothie. But they did that, and they gave it to them every day for 10 weeks. Other ways that you can give it to them is through enemas, or you can actually put it in capsules too, is the way some people do it. And they treated them for 10 weeks, and after 10 weeks, they found that the average, there was a 23% decrease in core autism symptoms. But what was really interesting is that they followed up with these kids 2 years later, and the kids hadn't received any more treatment at all. And they saw a decrease in core autism symptoms by 47%. So it actually got better as time went on, which is something that doesn't really happen. Usually after you get a treatment, slowly things kind of either return to the way they were, or at best you can hope that things don't get worse. And then they actually got better, which indicates that, okay, once we put this into their gut for a proper microbiome, it actually potentiated itself. And and so a lot of these kids actually, what we would say, fell off the spectrum, so they no longer exhibited signs of autism. So this was a study, and you would think that they would do more of those studies, but they're really not. And this was done at the University of Arizona. Okay. So when we talk about, okay, how do we actually heal the gut if it is messed up? This is the Interfunctional Medicine. This is what they have coined, the 5 R's, and it's pretty much what we use in our practice. It's definitely something that I pull from when I work with people. But it's replace, remove, replace, repopulate, repair, and rebalance. So the first thing is you do have to remove food overtly inflammatory. So that's why elimination diets can be very helpful initially to start with. But it's not just food. You have to remove certain medications can really compromise it. For example, I mean, a lot of people are on antibiotics kind of chronically, whether because of Lyme or acne. There's different reasons why that might be the case. But so remove medications, stress. Like I said, if you're stressed, if you're overly stressed and it's impacting your gut, you can do all the right things and you're not going to get better. So sometimes that's the first place to start, even though it's the most frustrating place to start. And then infections. And so some people, they might have parasitic infections, which are actually a lot more common than people think in this, you know, we're in the first world. I was like, third world? No, we're in the first world. People don't think about parasites. They think about parasites if they were to go to Mexico or something, but there are parasites everywhere, and it just depends on whether or not your gut can handle and keep at bay any parasites that it might come into contact with. But also there are viruses like cytomegalovirus. In this area, Lyme is very important and very impactful. So sometimes Lyme is really something that's triggering a lot of disruption. So that's remove. And then replace. So we talked about if you have low stomach acid, sometimes you have to replace the stomach acid. That's what this HCl is. If you have low digestive enzymes, so if you eat food and it just sits in your stomach, you might temporarily need digestive enzymes to really help you break down that food so it doesn't cause more problems as you eat. Bitters. So there's a whole range. I mean, you could just eat more bitter food. So that could be arugula. We're coming into spring. There's brassicas. They pop up and they're everywhere. And those are bitter and they are free, and kind of goes along with the idea that you know, all the medicine you need kind of grows in your own backyard. I like that a lot. Before you just start eating weeds, maybe, you know, go out with somebody who knows how to identify them properly. But that's something that I do, and I know a lot of people who do that. B vitamins. So if you have a compromised gut, what often happens is that you don't absorb your B vitamins even if you eat all the right things. So replacing your B vitamins with a supplement can be hugely helpful. Vitamin D, everybody's low because we don't run around naked the way that maybe we were intended to as humans, and so as a result, everybody's low in vitamin D. So it can be very helpful to take vitamin D. Magnesium, especially if your motility is low and you struggle with constipation, that is a major thing, and that's often the place to start, is getting your bowels to move so that it doesn't back up the way that we talked about. And so magnesium, especially magnesium citrate, is very helpful with that. It's so effective, that's actually what they will often use when you get cleaned out for a colonoscopy. But you don't need to take that much, just take a little bit. And glutamine. So glutamine is an amino acid. It's in a lot of foods, but one food that is getting right now that has it in is bone broth. So bone broth is super rich in glutamine, and that's why it's very helpful at healing the gut. Let's see, repopulate. Probiotics, so we already talked about that. It makes sense why you might need them. Prebiotics, and then repair. And I should say, you know, this is the order in which it's listed: remove, replace, repopulate, repair, rebalance. Depending on what your specific needs are, you might need to start at one place and a little bit and a little bit there and a little bit there. It's a little bit different for each person. You can actually do all 5 of them together sometimes, and sometimes you have to do it one step at a time.